My name is Pau Chung Chen. Now I'm going to give this afternoon session a second presentation. My presentation will focus on what activities we have done in the COVID-19 epidemic in Taiwan, and also I would like to introduce finally we passed the Public Health Specialist Act. Hopefully this act will help our public health education, especially in Taiwan. Since this year, January 21, the Taiwan first case occurred in Taiwan, and the deep blue color is imported the cases. The green color is the local cases, and the light blue color, the soldiers come from the Navy ship. So since the 21st January, our association, Taiwan Public Health Association, try to promote not only public health education for our students, also for the general public. So as we know, before any effective vaccination and pharmaceutical treatment, what we can do is pharmaceutical intervention. So I think the most important is how to use the healthy like the face mask or the hand washing, those healthy behavior to help us to prevent any the new cases. So well, in that time we thought what we can do, especially for the public health specialists during the COVID-19 pandemic. So we according to the 5 core competencies that follow the United States the CAPH the guideline. We have the 5 core competencies, including statistics, epidemiology, health policy and management, the health sciences and the social and the behavior sciences. So under the core competency, we thought what we can do. So we, for example, under the statistics and epidemiology, like the outbreak investigation to prevent the further spreading, communicable disease surveillance, and the prediction for targeted precision preventive policy and the measures. Also, in view of the health policy management, we can do some integrated coordinating for the prevention and the control the policy and the management, and also strategic preparedness and the responsible plan in national or local, even the hospital, the level. From the environmental health sciences, we also include the environmental sanitation, not only indoor ventilation, service management, household waste, and also how to use the personal protective equipment, and also have the company or company to sort out the employee has the surveillance and the protection. I think the most important is the social behavior sciences, because if we have teach the general public to have the good behavior, the healthy behavior. So the health education can enhance health literacy and of the preventive measure. Also, we can get the risk communication for general public, for public health emergency to avoid any public panic response. So under this design, we designed the training course just one day because in that time it's very emerging the stage. So we just hold the one day the training program. Also use like today the webinar to teach the students in the whole Taiwan. This training was held February 22nd. In that time, we followed the design. We gave the several courses, including COVID-19 and global health governance, current epidemiological features of COVID-19, transmission dynamics, and outbreak investigation, how to do the personal and environmental protective measure, public preventive behaviors, even the preparedness and the contagious planning in response to COVID-19. So this very short, the one-day courses to help our students to know what we can do, especially during the COVID-19 the stage. So we also use a lot of the other, like the very short the version, use the display to give some education for general public. For example, we showed how to use the face mask, how to choose the face mask, how to use the face mask, especially in the very early stage. We didn't have enough the face mask to protect us. So in that time we encouraged the use the face mask. So use this way how to wash your hand. So use the very simple the figure for the general public to help our government to train to give some education to general public. This was done the general 13 February this year. Also, our association tried submit several commentary for the newspapers, try to persuade our government, also educate the general public. For example, we during the shelter of April, we try to encourage the social distancing. Because not only the use of face mask, also to encourage the social distancing, this measure to help us to avoid to prevent the new cases. So we use this way. We submit the several the comments to the newspaper, not only to help our government, also help the general public. So I think this also this not the professional training for public health specialists, and still very important how to give the knowledge, give the literacy to the general public. Also, because a lot of the religion gathered, so we also made the joint statement with the Taiwan Pulmonary and Critical Care Medicine Association, and also the Taiwan Infectious Disease Association, to give the joint statement to help our government to persuade some religion activity should be stopped in that time. So this joint statement was published on February 25th. Also, we continuously use the very short version, use the figure to say what the public health specialist can do during the COVID-19 pandemic. Use this way to persuade the other professional group to help us not only because we try to get the public health specialist the act to so we also use a lot of these very short very so-called the very short the information for the not only the public students, also the other professional group. So in recent time, we also have our government. We are doing health behavior monitoring of new life movement for COVID-19 disease prevention under the Taiwan National Health Command Center, and also collaborate with the Taiwan CDC. This is our association. Mostly important, we ask the 11 public health departments or school in Taiwan to join this program. So finally, we recruit more than 300 students, public health students. Not only some of they are undergraduate, some of them they are graduate, and to get the health behavior, the monitoring, the interview, to help us, our government, also get the practical training during the COVID-19 the stage. So for those students, we also try to give the some education before they got any activity. For this 2-day training, we also provide several courses, including we introduced the COVID-19 pandemic, how the public health specialists, what we can do, epidemiology features, public preventive behaviors, information analysis, questionnaire survey, and give some training. So for those 2-day training, also we very short training, not the formal courses, but in the urgent stage, we use this way to recruit more than 300 public health students or graduate students to join us. Not only their teaching courses, also give them the knowledge and the activity to help our government. So after that, we must think about what the difference between the public health specialist with the medical professionals. So from the public health specialist, we focus on population, not on person. We are doing the prevention, not only the diagnosis. We use the promotion. We don't do any treatment. Also use the behavior environmental intervention and focus on the population health. We call this precision health. So a lot of we have the complete differences with the medical professionals, because we are focused on the population health, not only the patient, especially individual the patients. So this is, I think, this is public health training most important the principle we only focus on the population, the health. So from the United States or European country, they also set up a lot of the so-called capacity, the competence in the domain, how to use the basic core competency to develop to the different the power, different the competency, the domain. I think that we are still thinking about how to develop our competence domain in Taiwan, not only based on the core competency, also use the 5 core competency to develop the different type of competency in the future. For example, systems, the thinking, evidence-based approach to public healthcare planning, how to do planning, how to make the policy, leadership, communication, interdisciplinary practice. I think what's very important to continue our professional development in the future. So until now, we still follow in United States ASBPH the so-called 5 core competency and also interdisciplinary cross-cutting the competency list design to help us the public health education in Taiwan. So finally, on June 3rd, our Public Health Specialists Act finally get approved. So before that, I would like to mention, since the National Taiwan was set up the first Department of Public Health in 1972, since then, the Taiwan tertiary institution have trained the tens of thousands of public health professionals. So for more than 4 decades, this individual has shaped the country's public health landscape by engaging in the policy making, providing public health education to community, and also take part in the epidemiology study. So in 2000, we proposed the first draft of Public Health Specialist Act, and finally this year, the May 15th, our legislation and passed the final the Public Health Specialist Act. So given the country's economic and social development, the legislation will greatly enhance the ability of the Taiwan public health system to manage the challenge such COVID-19 or the future some of the other emerging infectious disease. So for those, I would like to give us a little bit about the information about the Public Health Specialist Act. We have the 5 chapters. Totally, we have the 40 articles. For most importance, who will can join the public health specialist examination in the future. So, for example, because they graduate, they get the certificate from the public health department, the school or college, the program, they can join this kind of examination. Also, they get the medical or public health related department, the school or college program, and at least 18 credits with public health. Also, they can join this examination. Finally, we also encourage the public health professional to get this examination. So if they have the certificate from the medical or public health the school, and also they already have the job in the public health related work for at least 3 years, they also can join this kind of examination in the future. Very important when those people that get the pass the examination, where they can do the business the setting. For example, they can employed by the medical healthcare long-term care institution, public health specialist office, or other institution site approved by our government. The second one is the institution other than the previous subgraph, but the staff with already with the public specialist in accordance with the law. Also, after they practice of for 2 years or longer, they can do by themselves to set up their own public health specialist office alone or together with the other public health specialists to set up their own office. So this article to define define the practice, the business, the practice. More important is what kind of activity the public health specialists should practice. First is the planning, promotion, and evaluation. Environmental health risk and the proposal for community and the site. So we very important that we try most under the population health. So most of the proposal just focus on community or specific at the site. Not only environmental health risk like the COVID-19 disease investigation and also public status investigation, health promotion proposal, even the food safety risk investigation, and the quantitative and the quality management proposal. So those are already defined what kind of activity can be done the public specialists. Finally, we also like to keep the other public affairs. If the government approve, they still can do these activities. So because before this act, a lot of the medical professionals already done this very similar activity. So if those belong to the follow force situation, it should not be subject to the restriction of this act. For example, the practice by medical staff or other professional technician, the technical staff which affiliate with their business activity, something like this. Also very important, like COVID-19, in case of the emergency or major public health incidents like the COVID-19. So our government may designate the public health specialists to carry out the activity under the first paragraph of the previous article. So that means our government they have the authority to require those people to do the public health the activities if the government approved to do that. And the public health specialists should not refuse without the justification. So when we are facing the big issue, emergency issue, we need this article to help our government. So finally, we get the parts of our registration of the Public Health Act. Hopefully, this will already share our public health education in the university or college. I think that we are still thinking about how to reshape our old education, especially the public health, the practice, the training is most important. So the final slide just shows finally we get we got the parts of our activity. Hopefully this act can help reshape our public health education in Taiwan. Thank you.